Hello, everybody. I think Sarah will be attending virtually. At least that's what she said earlier today, so.
Send her the link, I hope it works.
If everyone else is ready, we'll call our meeting to order. Would ask everyone to,
If I can interject, Dr. Woods just pointed out, there's an adjustment to the agenda. We don't need to elect officers
I was
again.
gonna say, we kind of did that last time. Otherwise, I wouldn't be sitting here. Yeah, I was going to note that. Okay, so let's move right along to approval of minutes.
Make a motion, we approve the February 23rd minutes as written.
Do I have a second?
Second.
Okay, all opposed? All in favor? All right. We will accept these minutes as presented. Division reports are next. Everyone can take a moment to review those.
Tara, I can't think of a time we had 2 consecutive months, we had no overdoses or suicides. That feels
Fatal
amazing.
overdoses, yeah, that is, it shows that something's working.
One thing that might be particularly interesting is the Grant County HIV. That was brought up last time because it's not tracked in our usual infectious disease reports. The state monitors it separately because they consider it a chronic disease versus like the way gonorrhea or chlamydia, where people get it and can be cured. Also, because small counties, when they give all the breakdown, it can identify patients pretty easily. This is what they can release, just showing the number of cases we've had, but they don't give the specifics of what age group, gender for public.
So it's just a number with no demographics attached.
Right, yeah. So in 2025, there were 6 new cases reported, and brought a total case count in Grant County to 97 individuals. I think Sarah had asked about that information last time.
Okay. Was 21 the first year that we tracked this, or?
Probably just what she requested.
Okay.
The 23 lead cases, is that, can't remember from meeting to meeting. That's uptick or,
I think that's pretty consistent. There's always quite a few working as some are being closed. Some cases are being closed, new ones because of the screening that pediatricians are required to do. So it's just a continual flux.
Has everyone had an adequate opportunity to overlook everything? I would entertain a motion then to approve the division reports. Okay. All in favor?
Aye.
Opposed? We will accept our division reports. Dr. Woods, your turn.
I have a couple of things I'd like to talk about briefly to highlight some of the work that the Environmental Division is doing. On April 18th, there is a Grant County Tire Amnesty Day. And this was, if I have the story right, one of our, Josh, who also is our lead specialist, had the idea because he was doing vector control about seeing how we manage all the tires, because you can't just get rid of them and it's expensive. And so in collaboration with the Recycle Center, they're having an Amnesty Day on April 18th where people can bring in their tires that are laying on their property. And the Eastbrook football team is helping in the endeavor as a part of community service. So it's it's definitely collaborative. And so the word's gone out on social media and all, so people can get rid of the tires. And again, that's to help prevent West Nile virus in the county. So I thought I just think that's good work. Another thing that the Environmental Division came up with is because they're out a lot in the community, they often run into homeless people. So Josh went to members of his church and some other people went to like lodges and got donations for backpacks to distribute when they're out working the streets, to give some supplies to people that are needing things like toothbrush, soap, socks, those kind of things. And that was a totally on their own, seeing a need and finding creative ways to fill the need in the community. So again, good work. And then the other thing that they came up with, we also inspect the tattoo parlors. I didn't know that when I took the job. I don't have any tats, so.
It is kind of a new thing, but yeah.
But the tattoo parlors are required by law to have proof of disposal of their sharps. And they have to bring in something to document that they have done that. Well, we have a sharps container that's large and it's dumped twice a month. So they had the idea, how about if we invite the tattoo parlor owners to bring their sharps and use our disposal, because it's never full, it's never near full, and they can sign in their proof that they've done that. And it just was an easier way for the community to meet compliance needs. The state had never heard of anything like that, and they were just blown away at the creativity of coming up with something like that. So again, kudos to the Environmental Division's team and the good work that they are doing.
What day was the tire amnesty again?
It's April the 18th.
Okay. And was there a limit on how many per household or anything like
I
that?
believe it's 10.
But last year, we had the same vehicles come through like 4 times. It wasn't
10 at a time.
wasn't heavily scrutinized, so.
But it's true though, with vector control, a large issue with vectors is old tires, old containers sitting around collecting water, and then
Old backyard pools that have collapsed.
yes.
So many of those.
Yeah, and then they collapse or the liner gets a hole and they're just like, and then it turns into just major breeding ground. So kudos to them for thinking of ways to
There,
eliminate things like that.
there will be 4 large.
So Solid Waste District is covering the expense because apparently it's $6,000 a trailer. So they'll fund up to 4 trailers. Last year we filled 3, so we should be okay. They'll fill up to 4, cover the
And
cost.
where is the drop-off location again?
Out at the recycle center on
Okay,
Garthwaite Road.
on Garthwaite. Okay, that's what I thought I heard, but.
8 to 1.
8 a.m. to 1.
Last year we were the physical labor. Oh my goodness. Big
Yeah,
mistake.
I would not want to be doing that. I'm glad the football team's helping out. Let the young men
Yeah.
get a little
Yeah.
exercise.
Yes, so thank you.
Excellent. Thank you, Dr. Woods, very much. It does not appear that we have any old business to discuss, or any new business to discuss unless you folks have some to bring to our attention.
Next, nope, I'm nothing.
Okay. I would open it up to public comments. Our one public.
Here for the newspaper.
Okay, all righty. Well, this was incredibly quick and very efficient, and I'm happy to hear some good news and also some excellent community activities that are going to benefit all of us. So again, thank you very much. We do have an executive session to follow this meeting to discuss personnel matters.
Can you close this meeting?
Yeah, so in light of that, I believe we will adjourn now and move on to our executive session.